afternoon, everyone. Before I start, I want to say Happy Latino Hispanic Heritage Month. It's on Sunday, but I gotta take the chance. It goes with the topic. So thank you, Maria, for the introduction as well. I'm gonna be talking to you about what our team is doing to recruit older Spanish-speaking people in a neurocognitive aging research study here in the North Carolina area. So why is it important for us to focus on the recruitment processes and outcomes for older Spanish speakers? Well, currently, Hispanics are the largest ethnic group in the U.S. There's about 62 million Hispanics living here. Within this group, 72% of them report that they speak Spanish as their primary language at home. Data also shows Hispanics are 1.5 times more likely than non-Hispanic whites to have dementia. However, they only represent 10% of participants in NIA-funded clinical research with a median of 2%. So to reduce health disparities, research should keep in mind what recruitment strategies enhance recruitment retention for underrepresented communities, in this case, the Latino community. So the study that we've focused, and I'm going to present the results from, is the LAMP study, which we started last October. It's a cross-sectional community-based observational study designed by Dr. Merguine with the goal to develop normative standards in neuropsychological tests for older Spanish speakers. So as you can see, our participants are between the age 60 to 85, and they do not present any central nervous system disorder or psychiatric condition. Our participants complete a very comprehensive assessment in our study during 3 stages, one 30-minute phone screening, one in-person screening visit of about 2 hours, and one study visit that is 4 hours long. So past research and past experience our team had in community-based participatory research in the Latino community, we anticipated the following barriers for participation in research. For example, instrumental barriers such as how much time does the person have to complete study visits. Some of our participants have to take care of grandkids or work 2 jobs even at this age, which impacts how they spend their free time. Also the cost, our participants sometimes have to take days off work to complete the study visits, or if they come to the clinic, they have to worry about, are they gonna pay for the meal, parking, and so forth. Transportation, most of our participants do not own cars, or they heavily are dependent on rides from family or friends. And the most important one is that we expected a level of lack of awareness of research and mistrust in the community. So the design of the study has different factors to reduce the instrumental barriers I just explained. For example, we offer flexible scheduling. Some of our participants complete study visits on the weekends or even after work hours. We also offer a unique compensation. We do compensation process in cash payments, and we do not ask for social security numbers to be mindful of documentation status in the community. We also provide meals if they come to the clinic and assistance with transportation and parking passes as well. We also offer at-home visits. About half of our participants have completed their screening visits at their own homes. And we're trying to be mindful of language and culture as well. All our study personnel is bilingual and bicultural, and all study procedures and materials are in Spanish. So to address mistrust, we knew it was going to be important to really connect with the community through different outlets. So our clinical research coordinator, Fernanda, she's sitting right there, it's our recruitment leader, and she has been working with the Latino community for the past years here in this area. So through her connections, we have been able to connect with different groups in the area and bring the study to them. Another way has been through our partnership with different community groups and community leaders in different churches, libraries, nonprofit organizations, and also libraries. For example, we recruit participants through the endorsement of pastors in churches, community health workers, and they have really helped us promote the study within their groups. We also do snowball recruitment. For those who are not familiar, is when a participant has a great experience and they refer the study to a family or friend. So we even schedule simultaneous visits for those who want to come with a family, relative, or friend, so they complete the study visit at the same time. And lastly, we wanted to make sure not to only address barriers, but go beyond by giving back to the community. So we give participants their neuropsychological testing results. So here in this table, you can see some examples of how our participants report finding about the LAMP study through different recruitment sources. Like I said, we have done some community events such as pantry events or health fairs or festivals. So here you can see some example of how they report finding out. Okay, so our results have been that we were able to surpass our enrollment goals. Additionally, if you see the participants' demographics for those who completed the study visit, we're capturing a variety of heritage backgrounds, and a third of our sample was able to speak English well or very well. So high school was also the mean education for our sample. Okay, so the most common recruitment source that our participants reported was community partner referrals with 40% and community events with 36%. However, community leader referrals and family and friend referrals were the most successful at retaining participants. 47% of those who reported interest in the study ended up completing all study procedures from these recruitment sources. Okay, previous literature has emphasized that people with higher educational attainment, such as college, are more likely to participate in research. However, we're seeing here that different community recruitment strategies are yielding a variety of educational attainments for our study. For example, people who were recruited through community events had lower education than high school compared to those who were recruited through a family or friend referral. So what did we learn? We learned that by being culturally sensitive and building trust with the community, we achieved 50% of our 4-year enrollment goal in just 9 months. Our most common recruitment was with community events and community leader referrals. Additionally, different community recruitment strategies expand the diversity of our participant sample. And I think most importantly, the key takeaway is the Spanish-speaking Latino community here in the area is really ready to engage in aging research. But are we ready? Are we ready to implement those strategies that reduce participation burden? Okay, I want to thank everybody who has contributed to the LAMP study and also our DAR team, Diversity in Aging Research. And at the bottom is my contact info if you have any other questions. Thank you.
Thank you. That was really great. I'm impressed with your success in recruitment. I was curious, I noticed that you didn't get many referrals through social media. Mm-hmm. Was that expected, unexpected? Is there a way to use social media differently that might help you recruit through that venue?
Right. I think for this particular study, because every study might be different depending on what community you're trying to recruit, right? For this particular study, so we didn't implement a lot of recruitment strategies in social media, but as the results are saying, people want to see us engage with them. So make sure to, be on the ground, dirty work recruitment, where the community is at. Meet them there. Also, our participants are a little bit older, so, I'm sure if you recruit younger participants, social media will be probably more effective as well. But yeah, this is for this study. Mm-hmm.
All right. Thank you so much.
Thank you.